We have her on phone, and her name is, first of all, let me just say, I'm so glad she could join us because this is a great topic, and we hit this topic so often on this show, but I want to hit it again. Talk about the idea of socialism, and in particular, why socialism seems to appeal to women. And so we have Romina Boccia on the line. She's joining us from Washington, D.C. She's with the Heritage Foundation. I think we have a picture of her to show you. She is the director of the Groven M. Herman Center for the Federal Budget, Institute for Economic Freedom at the Heritage Foundation. She's a prolific writer. She testifies various places. She's on all sorts of national media. But I want to get her on today to get her thoughts about this poll that was done recently. It was an Axios poll, or an Axios on HBO poll, that essentially said, in America, 55% of women prefer socialism. I have a problem with this, Romina. So let me, first of all, welcome and thank you for joining me.
Thanks so much for having me.
So what do you think explains this? I mean, this poll is revealing in America that more women than men are sympathetic to or in some way drawn to socialism. What's your sense about why that would be?
I think it's because people misunderstand what socialism means and what it is and what it represents. Whereas traditionally, socialism was defined as government control of the means of production and distribution, meaning the government owning major industries and controlling major aspects of our economic lives. That's not what today's generation thinks of when they hear the word socialism. They hear social as something that is good, and so they consider socialism a more compassionate kind of economic system that takes care of those who are most vulnerable, that occupies itself with reducing inequality in society. So they're not thinking of the socialism of the Soviet Union or even what we're seeing in Cuba and Venezuela. They're much more thinking of a kind of coddly kind of state welfare system, perhaps more like Sweden and Norway, which those are capitalist nations, but they have extensive welfare states. So it's a question of definition. I think in this case, we know Gallup has found that people's definitions of socialism have changed significantly. There's been a major rebranding effort that's been going on to rebrand socialism as something good and nice. If you will, this is a Trojan horse, and it seems to be succeeding. So we have to remind people what socialism truly means, and then we can remind them of its effects, because we know just how this is going to work out, because we've tried it many times in history. Thankfully, never in the United States, and hopefully we'll never have to find out firsthand just what socialism really means.
That is a great answer. I love all the points that you made. I want to embellish on something related to what people think it is. If you think the government is going to be able to provide things for people, they don't. I agree with you wholeheartedly that people who embrace socialism today, they don't really mean they want the government to own the means of production and control all the economy. They just want the government to adjust things to make things fairer. And fairer meaning there's concern for people of low income, people struggling, and somehow the government should make things fairer. But it always must involve an element of coercion. The government can't make things fair and get more money to some people without taking it away from other people. It is why I think you had written something about this. Socialism always ends up in tyranny. Do you agree with that?
That's right. And I think what we're seeing among many young people today in the United States, and also many of these women who responded to this poll favorably, is that they're conflating equity, a concern for fairness, for a level playing field, for opportunity for all, with equality. You cannot have equality and freedom coexisting, because what freedom brings out is that we aren't equal. We are equal. We should be equal before the law, but we aren't all equal in our abilities. We aren't all equal in our intellect. We aren't all equal in our motivations. We are unique individuals with different unique capabilities that produce different kinds of values in society. And somebody who works very hard, works extra hours, saves his or her money, we're going to find different outcomes when it comes to earnings and how much wealth that individual is able to amass than somebody who takes more leisure time, who enjoys spending their time in different ways than working, or who chooses a job that where they can have meaning, say in the nonprofit sector, over a more risky job, say working on an oil rig. We see all of these factors play out in how much people earn and how much they save and the wealth that they're able to generate. And this whole notion of equality of outcomes flies in the face of it. Inequality is a necessary outcome of our freedom to make choices. And it's very different from equity, which is about fairness, such that the person that works harder is able to make more, is able to earn more. And when you ask young people, do you really believe in equality? They believe really what they mean is equity, because then when you say, okay, say you worked really hard on the math test, you studied all night, you got an A, and the person next to you went out drinking with his friends and he got a C. Do you think it's fair if both of you get a B? Because that's equal, right? We'll take the A and the C and we'll give you both a B. And they all go, no, that's not fair. So you see, it's really about conflating equity for equality. But you can't have freedom and equality, because in order to make us all equal in terms of outcomes, like you said, it requires coercion, and it ultimately leads to tyranny.
Very well said. I love that example of the college grades and the the idea that you want the results of what you work to earn, and everybody does. Everybody does, whether it's the workforce and their grades in school and 1,000 other ways. We expect to have reward for hard work and labor. I love that example, and I'm glad you raised it. It's kind of interesting, though. There has been so much argument about in our society that, well, okay, some things are going to have unequal outcomes, but things like universal health care, that was one in this poll, one example of where women were saying, hey, we've got to have health care provided for people, and this just seems only fair. Health care is a right. And so it gets people thinking that this thing that can be provided by the government, access to health care, can be provided by the government without any impact on the quality, the access, the extent of health care. It's another myth that is just derived from ignorance about the role of free markets and freedom and the provision of health care under a system that has freedom versus a system controlled by the government. But I think that leftists have succeeded in convincing women especially that health care should be a right.
Yes, you're absolutely right, and it does represent wishful thinking. Not wanting to consider that there are always trade-offs and that resources are limited. And we need some mechanism for allocating the limited resources that we have in light of unlimited human wants and needs. And the market, the free enterprise system, is the most effective and fair and just system that relies on individuals cooperating towards their own benefits, serving each other in the process, and it's the most effective mechanism for allocating scarce resources among competing uses. We wouldn't need to have this conversation if money was falling from heaven and
right.
There were no resource constraints. But when it comes to universal health care, the idea sounds very good. And in the United States of America, we don't leave people to die on the streets. Everyone has access to health care. The question is, how do we pay for it and what kind of health care? And we don't need to look very far to see what a Medicare-for-all proposal, which is a real proposal being considered in this Congress in the United States today, what that would look like. Because one of the requirements of that proposal is that all private health insurance would be banned. The government would control the entire healthcare sector. And you don't need to look very far to see how that's working out. You can look to England and their national health insurance system, and you can also look to Canada. And the way that those limited resources are allocated is via government rationing. And it is not universal access, and it is not fairly distributed. In fact, what you find is that those people who are politically smart, who are politically well-connected, who generally tend to be higher income individuals, actually are able to get more of the care. They are able to secure more of those nationalized resources for themselves. There is no equal and fair distribution in these nationalized health systems. Ultimately, what you find is worse outcomes. The UK, for example, has much worse recovery rates and also care rates for individuals with some of the worst diseases, like cancer, for example. They have higher death rates, and you have longer waiting lines and waiting for care, with some people dying, in fact, just waiting for care. So Canadians who have money, they come to the United States to have a lot of treatments done here because of those long waiting lines. And where are Americans going to go? If we turn to such an ineffective government-rationed system where bureaucrats control healthcare choices and decisions, where are we going to escape to? I think this is a very dangerous idea that is based on a wishful thinking that doesn't consider the realities of what government rationing actually means.
I just love everything you said. Thank you so much. I meant to mention to our listeners, we're speaking again with Romina Boccia, and she also, as well as being a Heritage Foundation director of the Grover Herman Center for Federal Budget, she also has a degree in economics from George Mason, a master's degree in economics from George Mason, and a Bachelor of Science in economics from George Mason with a concentration in data analysis, which leads me to a point I wanted to make. You explain things so eloquently and so well. It is incumbent on people on the conservative side to spell out the kind of arguments you're making, because to the uneducated or the person who hasn't focused on economics, it sounds like the argument between leftists offering free health care and people on the right offering free markets, and your responsibility to track down the kind of insurance you would like and find a means to pay for it and pursue and take care of your own health care. It's easier to sell the things that that the left wants to sell by just saying it's all free and it doesn't matter. But it is really counting on the ignorance of, in this particular poll, women and millennials, just not recognizing the fundamental economic realities that you are spelling out. And they're not that, sexy and exciting to spell out for people. They're just reality, though. They're just facts. And I think stories are so important for people to try to help Americans understand the dangers of these programs that are being pushed by leftists. There's Medicare-for-all, which is just basically socialized medicine. What really happens in socialized medicine countries? Why do the wealthy come to America when they can to seek medical care? The need to have that understanding spread, especially among women, is just an enormous need in our country. So I love that you're doing it.